The Trump administration taking major steps towards cracking down on the opioid crisis. Get this, the Departments of Justice and Health and Human Services conducting the biggest healthcare fraud crackdown in U.S. history, charging more than 400 doctors, nurses, and healthcare providers involved in healthcare fraud and opioid schemes worth, get this, $1.3 billion. And 120 of those charged were directly associated with prescribing and distributing those drugs. Joining me now, John Lauro and Dr. Howard Samuels. John, I'll start with you. You're a former prosecutor. Tell me, what do you make of this?
Well, you know, when Willie Sutton, the famous bank robber, was asked why he robbed banks, he said because that's where the money is. And this really shows that the Trump administration is going after healthcare providers, not just people in the healthcare industry, but licensed professionals who have violated the law. So it's a very significant initiative.
Dr. Howard, to you, I know you're in this business of helping addicts get off of these opioids, so you're very familiar with all of this. To what degree is the medical industry just locked into this? To what degree are people getting their drugs from doctors?
Well, we're finding a tremendous amount of doctor corruption and a tremendous amount of doctor abuse where, you know, the doctors are giving 60 Oxycontin, 60 Vicodin for just a few days of pain relief. And so there is such a tremendous amount of abuse. But I am so happy to hear that the government is cracking down on the corrupt providers. Because here in Los Angeles, it's not just the medical providers that are corrupt. There are so many independent providers, treatment centers, outpatient programs that are involved in all of this corruption. And, you know, the Hills Treatment Center, which is where, you know, I work, we're trying to stop this within the industry because everybody's suffering because of this corruption.
You know, I heard this interesting fact I want to share. In 2015, there were enough opioids prescribed in America to medicate the entire population of America for 3 weeks. Think about it. I mean, that is a lot of drugs out there. And I want you to hear what Jeff Sessions had to say about this crackdown. We heard him speak recently or yesterday on this. Here's what he had to say.
Too many trusted medical professionals, like doctors and nurses and pharmacists, have chosen to violate their oaths and put greed ahead of their patients. Amazingly, some have made their practices into multi-million-dollar criminal enterprises. They seem oblivious to the disastrous consequences of their greed. Their actions not only enrich themselves, often at the expense of the taxpayer, but also feed addictions and cause addictions to begin. The consequences are real. The emergency rooms, jail cells, futures lost, and graveyards are the results.
So, Jeff, here's the frustrating thing for me. These are taxpayer dollars being misused. This isn't just somebody going on the street and buying these drugs and then getting addicted. It's us. We're paying the tab.
Well, that's exactly right. And these are vulnerable people. These are people that are addicted, and they're being preyed upon by someone that you should trust, which is a healthcare provider, a licensed healthcare provider. The one thing I want to mention, though, there are so many good people in the medical system, and we can't overlook that. And this is really a medical problem, a behavioral healthcare problem, not just a law enforcement problem. But what the Justice Department is saying is if you're doing bad, we're going to come after you.
And it was interesting, they had Health and Human Services there. It wasn't just Justice on the scene there. Dr. Howard, to you, it was interesting to me. Look, the opioid crisis is like a decade or so old. It's been kicking around for a while, many, many years. But we're just now getting down to really what may be at the center of all this. Why has it taken so long?
Well, you know, I started shooting heroin at 16, and that was 50 years ago, and now I'm clean and sober off of heroin for 32 years. Now, it's amazing the supply of heroin used to be when I was using it just in like D.C., New York, and urban centers. Now it is in every suburb, every small town, Vermont, Ohio. It has spread like cancer throughout the whole country. And not only that, but the insurance companies are not giving the treatment team or the treatment centers enough time inpatient to deal with the heroin addict. we're only getting about 15 to 20 days inpatient to really be able to turn someone's life around from the insurance companies. So it's the government, it's the insurance companies, it's the providers.
They're going to put more money in this health care bill.
Page.
John, quickly.
Absolutely.
You wanted to jump in on this?
Thank God.
Well, the bottom line is wherever there's money, there's going to be corruption. And when there's corruption, there's got to be federal enforcement. So, I mean, the Trump administration is doing exactly what they have to do.
That's interesting. I think you make a very good point. That money gets abused over and over and over again. John, Dr. Howard, thanks for coming on. Appreciate your time.